Afternoon. It's great to be in Orange County. I want to thank Mayor Demings for reaching out about the barbers and the salons, very important part of our economy. The discussion was great. We were trying to just do things in a way that's safe, smart, step by step. This is something my task force had been discussing. We did not roll it out in phase one, but that does not mean we're not intent on getting the yes on this. I think the ideas that we heard were great. I'm going to be receiving some written product. We've got folks that have been consulting with physicians who've been working with written product as well. And I'm confident that it's not a matter of if, just a matter of when. But we got to get there. We got to make sure it's safe and sound and everything's good. I think part of the reason we're able to have the discussion is because we've seen a great amount of success throughout the state, but particularly here in Orange County. And I think the county health department, I think the mayor, I think all the folks who've been involved with that deserve a lot of credit. But also statewide, as of last night, Florida had 581 COVID patients in the ICU statewide. That's the lowest that we've had in a month. And for a state of almost 22 million people, that's obviously a very, very small number of patients. Here in Orange County, 1.5 million people. You have 21 COVID patients in the ICU. In Orange County, as of last night, 51% of the ICU beds were available and were empty. And so you've not seen the hospitals here get overwhelmed, not even close. In fact, we're part of phase one on Monday. We're unlocking these elective medical procedures because they have so much space in the hospitals and people really do need to be getting these procedures. In terms of ventilators, we're down to the number of patients on ventilators has steadily declined over the past several weeks. We're now at 356 patients statewide that are on ventilators. There are 6,361 ventilators that are unused and idle in the state of Florida. And so there's not going to be any lack of ventilators for anybody. And that's very, very important. Testing. Yesterday I was in Pensacola to roll out a new test site. As we do phase one, we believe we need to be testing even more. And we have been doing a lot of robust testing. We got almost 20,000 test results back yesterday. We've been consistently in like the 15,000 a day. We'd like to get more, but I would say part of it is we have some of these drive-through sites in different parts of the state, and our capacity does exceed the demand in many parts of the state. I think here we've had a good drive-through site that they've had pretty consistent traffic, which is good. But if you look at yesterday's test results, there was 723 new Florida cases out of almost 19,000 total test results. So that's a positivity rate of 4.1%. And if you look over the last 10 days, the positivity rate in the state of Florida has been between 6.1% and 4.1%. Just to put that in perspective, I think the national average is between 15 and 20%. You go to places like New Jersey, they're 45% of everyone who takes a test tests positive. So here in Florida, we're pretty consistently about a 95% negative rate for test takers. And Orange County, I think in particular, yesterday's test results, they had 18 new cases, but that was out of almost 1,760 tests. So the positivity rate in Orange County yesterday was 1%. And if you look over the last 2 weeks, they've been usually in that 1 or 2% range. I think that there may have been one day, actually one day was 4%. They had one day at 4%, which most places in the country would kill to have that. But then you're at 1 or 2%. And so I think if you look, one of the great stories is a community that has more traffic coming into it from everywhere in the world and the United States. There's no way you can have a pathogen circulating anywhere and it not end up in Central Florida with the tourism, with the number of people in our country that come here from various states. And so to have numbers like that, you look at all the indicators, such as the surveillance data for hospitals, the syndromatic indicators. You've seen really good declines in Orange County for cough-associated admissions. I think cough-associated admissions now are lower than they've been all year in Orange County, even with the pandemic still going on. ILI has gone down, COVID-like illnesses has gone down. So this is a great story here. And I think as Orange County and the rest of Central Florida has done such a great job battling this, I think they're going to be really part of the foundation as we get into these next phases and bring Florida back to where we want to have it. I think also, if you look at some of the other things we're going to be doing down the pike, we've tested almost 420,000 people now in the state of Florida. We have the 7 drive-through sites that have been operating for a while, including one at the Orange County Convention Center. But we're adding Pensacola, which had a soft open yesterday, large open today. We're adding Sarasota, Bradenton drive-through site, Naples, Fort Myers drive-through site, and then a hybrid drive-through and walk-up site at the Miami Beach Convention Center. So you're actually going to have more opportunities if you want to test, because we just feel if you're putting people back to work and maybe a worker has some symptoms, they're hopefully in these communities easy way to do it. And that's the drive-throughs aren't the only way. County health departments are doing it, doctors' offices. We're expanding it in many different ways, and I'll talk more about them in a second. But those drive-through sites are going to continue. When the federal government stopped supplying them, I called the mayor. I said, "You want to keep it, right?" He's like, "Yeah." I was like, "Well, we're going to keep it." So we've been happy to support that, and we're going to continue to do it. So we also, and you see it in Orlando here, and the county health department's done a good job. We've done walk-up testing community sites, and you set it up. People can walk up. You're able to reach out to underserved communities and offer testing in ways that are effective. So they've already done 10,000 tests just on the walk-up concept. There's 10 different sites. They've done a number of different locations in Orange County, which we really appreciate. So we're going to continue strategically deploying walk-up sites when we can. And then we've also done the National Guard. I have these strike teams, 50 strike teams. They've been going out in the nursing homes. They've tested about 12,000 people in nursing homes just over the past few weeks. Clearly, that's the most vulnerable part of our society to COVID-19, so we're going to continue to do that. We also are going to be launching, hopefully early next week, a mobile lab in a converted RV. So you're actually going to have an RV from the Florida Department of Health, Florida Department of Emergency Management, and we are going to be able to do tests and then get a result within 45 minutes for people. So you can take this RV, you could drive it up to a long-term care facility, you could test the staff, test the residents, and then get them the results within a matter, each test 45 minutes, you do a certain amount of tests. But I mean, really within a matter of hours, you're going to be able to get test results. So I think that's a huge force multiplier for us to be able to do that. So I hope to be able to announce that beginning of the week, but certainly next week we'll be able to do it. We also are seeing fruits from the decision that I made to let the licensed pharmacists administer COVID-19 tests. Very important to use all the tools at our disposal for this. So Walgreens just announced they're opening 9 drive-through sites in Florida, including 2 in Orange County, 1 in Orlando on Narcosuke Road, and then 1 in Winter Garden on Winter Garden Vineland Road. So those will be good. I think those will be convenient. CVS is also getting into the game. They haven't announced where their sites are going to be, but they're going to do it. And then so is Walmart. They're opening up 5 drive-through sites across the state through a partnership with Quest Diagnostics, and that's something that we look forward to. We also have a new machine that we're going to be debuting next week down in Miami. It's a machine to clean the PPE. So you can decontaminate these masks up to 80,000 a day. And if you decontaminate the mask, you can wear it 20 times, which in terms of this shortage, I mean, although I think the supply has started to flow a little bit better, but a month ago it was very difficult to get this stuff. But we have that so that it can be reused, and I think that that's going to be very, very important as we go forward. So I think that Orange County is really poised to help us move forward. We're going to be safe about it. We're going to be smart about it. It's going to require step-by-step approach. It's not something we can just flip a switch on. But I think that this is one community that's really showed that you can get it done. And I look forward to continue to working with everybody here because I know there's so much that they have to offer. I give the mayor a chance to say a few things, and I'm happy to take some questions.
Okay, let me start by saying thank you to the governor for being here, and thank you to the small business owners who have joined us here today. We realize that really here in Central Florida, we are a significant portion of the state's overall economy. And we have been working with a team of dedicated public servants, business owners for the last couple of weeks to really offer advice to me as we reopen Orange County itself. And I have to thank several of the individuals who are here with us today who have been volunteering their time for that effort. In terms of Orange County, we have 1,413 plus individuals who have tested positive for the virus here within our community, and 34 people have died as a result of the virus. So what I'm saying to you is that we realize that this is a deadly virus, and as we reopen, we cannot forget our responsibility to make sure that we reopen in a very judicious way and a safe manner. And what I've heard from many of these small business owners here today who just happen to run barbershops and hair salons and nail salons, that they are committed to ensuring that as they, if they are allowed to reopen consistent with the governor's executive order, that they will do so in a safe manner. And for me, the guiding principle really is to ensure safety first and then the economic recovery next. And there's a happy balance between the two that we are trying to attempt to measure up to within this community. And I know that Floridians have that broad desire as well. And so as we move forward, we want to make certain that here within Orange County, these small businesses have all of the tools by which to be able to open up successfully. So we are the recipients of $243 million in CARES Act funds from the federal government that can be used for various things. But one of the ways that we intend to use those dollars is to help our small businesses acquire the personal protective equipment that they need to be able to open up safely. So we have ordered 1 million plus masks here within this community. Hopefully we will receive delivery of those this coming week and we'll redistribute them. And 200,000 different bottles of hand sanitizer that will also be redistributed within the community. Then we will look to use some of those dollars to assist small businesses with their recovery efforts. We have a technical team that's looking at that within our county that will hopefully come forward with a plan in the very, very near future. We're working with the Board of County Commission here to make certain that we make appropriate decisions as we do move forward. And I've had the privilege of talking to our surrounding counties. So here within the metropolitan Orlando area, our counties have endeavored to be consistent in our approach as we reopen. This issue regarding the reopening of hair salons and nail salons and barbershops is one that we mutually have said that we believe is the right fit for our community. It allows us to set the stage for further reopening. Now, during this period of time, we will be working with the Florida Department of Health, and Dr. Pino has been with us throughout this battle with the pandemic to ensure that we are looking at data to make certain that there's nothing that we're doing as we look to reopen that will adversely impact the overall safety of the people who live here. So it is important that the testing continues throughout the state of Florida, but certainly we are concerned about the additional testing here within our community. We have endeavored to increase the testing, and thanks to additional supplies made available from the state, we have been able to increase the number of testing sites here within our county. We have a major testing site that is open as we speak at the Barnett Park, where we are testing individuals today. So we want to reassure our community that as they are tested, they have the responsibility to then protect themselves and protect others and their families from the potential spread of the virus. And so while we see the numbers flattening here within Orange County, we're not rejoicing to say that this pandemic is over. I want to caution people that we're not there. This is still a very deadly virus, and our goal is to make certain that while the numbers are low in terms of the overall percentage of positive that we see from the test, We want those numbers to continue to be low and to ultimately get to zero. That is our goal within the community. So it is important that we reassess on a regular basis of how we're doing, and that takes several weeks between each phase. We're in the governor's phase 1 of his reopening process, and so we know that during this phase 1 period of time, before we're able to go to phase 2 and open up even more businesses, we have to make sure that the data that is provided by the healthcare workers supports that reopening. So again, thank you to the media for being here, for helping us to communicate the message throughout our community. And with that, Governor, I'm going to turn it back over to you.
Thanks, Mayor. And one other thing, just on the testing, we've been, every day, I'm trying to figure out when our antibody, we got a number of different companies that are shipping us antibody tests. We're going to have hundreds of thousands of those. We were hoping to get them yesterday. We were hoping to get some today. This is like, we're literally on the phone with the U.S. Department of Transportation about when this stuff will come in, can be delivered from China. I think it may be in the U.S. now how it gets here. But the antibody testing will be very, very important, because that will let us know who has already had the disease. And there's many people throughout the country when they've done these antibody tests who have been determined to have it. And many of these people didn't even know that they were sick when they had it. So if you're somebody in healthcare, you have the antibodies, well, that makes a huge difference in terms of how you treat patients. Also, even in something like this, if a stylist has the antibodies, just important information for us to know. So what I'd like to do is, once we finally get all that stuff in, some of these testing sites, we're going to start integrating antibody testing into the normal diagnostic testing. And the diagnostic testing is important, but look, you could test negative tomorrow. It doesn't mean the next week you're definitely going to be negative. I mean, that's a dynamic. If you have the antibodies, well, that's something you know you have, and that's really, really important going forward. All right, with that, take some questions.
Governor, I know you had said that you wanted to get to yes to open these kind of businesses. What do you think is a realistic timeline for you to get that?
Well, I think what we're going to do is we're going to take this back. I'm going to have my folks work on it. When we get back, well, I'm in there every day, but when everyone else is back on Monday, we'll do that and make sure that it's good. I want it to be vetted by different folks. So throughout this whole time, I've said I'd rather get it right than get it fast. It doesn't mean we're just going to sit on our hands, but we just want to be very thorough about how we're doing it.
Governor, given the guidelines towards having masks or recommending masks when people cannot socially distance, particularly in businesses, and maybe this is a question for both you and some of the personal services representatives, but how would you look at esthetician services, waxing or beard trimming, things where the client may not be able to wear a mask during a service?
Yeah, no, I think that's something that we're going to have to think about. I'm not, I've never had a beard, so I've never done that or whatever, but obviously if you need to get there, it's just different. So we're going to have to look at that, and maybe we start with ways that can be masked first and then figure out how you move into that. But yeah, I would seek counsel on how that works.
Governor, when you were in Orlando last Sunday, you mentioned talking to someone about updating the state's dashboard so it distinguishes between total tests and individual tested. Do you still plan to do that?
Well, so if you look what they have now, so this is how they're doing it. They have here, so if you like Orange County, it's interesting. They can actually do this at a county. I mean, this chart right here is just phenomenal. So what it'll do is, so they'll do number and percent of positives. These count the number of people whom the department received lab results by day. The percent is the number of people who test positive for the first time, divided by all the people tested that day, excluding people who have previously tested positive. So that's the number that you look at, like for an Orange County. So they are doing that, and it's there. I would imagine if you had people retesting, that percent positive may look a little different. Who knows? It could be lower depending on where they're at, and then you'd have a few more tests. So that is how they're doing this percent positive. So that information's there.
But just a moment ago, you said 400,000 people have been tested, and we know that number's not true because that includes retests.
Well, no. So I think what you're seeing is we're at 450,000 tests, somewhere around there. So I would think that there's not enough people that have been retested. So I would imagine you'd probably have pretty close to that. I mean, so yeah.
But your comment was 400,000 people.
Right, but we have 450,000 total test results. and we'll have 500,000 test results probably by Monday. So if you look, there's a lag in the test results. So if you have 450,000 results today, the people who have actually been tested are definitely more than the results we've had, because sometimes this takes like a week lag. So you're probably looking at, we will get results probably between 10 and 20,000 a day, for the next 4 or 5 days. And so those are people that have already, by this point right now, have already been tested for sure. We know that.
Why does the state's dashboard reflect the number of people? Because you said 400,000 people. So why doesn't the state
All right,
dashboard?
I'll give him my answer. I understand this is important to you, but we've answered it. So.
Governor, just switching over to unemployment, is it true that the requirements for people that have to reapply every 2 weeks expires in the coming week, and are you going to continue to expand that?
So I'd have to look at when I did the order, but I think we did it for 6 weeks.
Yeah,
so
May 8th is when it.
So we'll look at it. Here's the thing about that. It's really just, they got to go on the site, click it. And so a lot of people were still doing it anyways. The reason why we did that was less because we were worried about people still we know they're going to still be unemployed in this period. It was to take some stress off the system, because as more people are going, it means fewer can be processed. What's happened though is that they've done so many structural changes for this that the system is holding up a lot better. Now, I'm still fine with extending it if we need to, but that problem today is a lot better than it was 4 weeks ago. What they did last weekend was because you can still go and apply on Pega, but they took down Connect from the public interface because they use it just to process claims. So they made last weekend, I think, between 450 and 500,000 payments by doing that. I talked to the DEO folks this morning, and they're processing again and doing that. So by the time we get to Monday, they're using this time to really make an impact there. So if I have to waive it, we'll waive it, but I'm not as worried about people going on and just clicking that button than I was, because you had a month ago, you had people would go on and the website was down like 75% of the time. So they couldn't physically even do it. So we didn't want a check to be held up because somebody wasn't able to click a button on a website that wasn't working.
Following up on unemployment, the Lieutenant Governor told us that you all would make sure that the eligibility concerns were looked into, because there were a lot of Disney employees who were auto-enrolled or had their auto-enrollment process, other folks who had their applications prepared by people who used to work in the unemployment office who were deemed ineligible, even though it seems that they meet all the criteria, weren't using PTO. Is that something that the administration has asked DEO to look into?
Of course. So I will hear periodically when I go to the press, hey, we just heard from someone that applied March 18th, they still haven't been paid. So then we have DEO look. If somebody is online on social media or in articles, DEO actually will go, they'll get the information, and then they'll try to look at that individual. And I think what they found is a lot of times you go in the system, the application wasn't complete, there was no social security, maybe they didn't have a job or weren't employed and so wouldn't be eligible. So there's all those different things. But I said, are people getting paid who applied like 2 weeks ago, but people a month and a half ago aren't getting paid? And they tell me that it's a automatic thing. Once you're processed through, it goes. They would not hold anyone back for any type of arbitrary reason. And so if somebody is still in the queue, it's because there's something that's not satisfied. And so that's what they're doing. But if somebody has all the criteria and they qualify under the law, then obviously they need to be processed. I understand though, we cannot change the eligibility under the law. It just is what it is. So if you're not eligible for that, you then get kicked over. There's another part of relief from the CARES Act, which you can be. So you have the state unemployment, federal CARES Act unemployment, and then you have another pot of people who may just not have been working but need relief, and so you'd end up getting kicked over into that area. I want to thank everyone for coming out. I want to thank the mayor. I want to thank all these great folks, small business people. These are really important establishments, and we want to do what we can to get them up and running in a safe manner. And